Welcome back, Mocha Mamas. I have a special episode planned for your mini-me's today. We are chatting all about the menstrual cycle. We're going in on everything from puberty to periods, made simple for your teens and tweens. Let's get into it. Puberty is a time when your body starts changing both inside and out. When puberty starts, your brain sends signals to certain parts of your body to start changing and growing. Those signals are called hormones, and those hormones help to control bodily functions. Some of the changes that you can go through as you start to go through puberty include the following. You start to grow taller and gain weight. Your hips may start to grow wider. Your breasts may start to grow and develop. You grow hair under your arms and on your vulva. Your body odor may change. You may get acne or pimples, and you get your first menstrual cycle, also known as menstruation, also known as your menstrual period, or your period or unflow. Now, these changes don't all occur at once, and the time frame is different for every girl. It's perfectly normal to start to develop some of these changes as early as the age of 8 or as late as 13. So there's absolutely no need to worry if you develop before or after your friends. Breast development is the first sign of puberty, and the average age of breast development is 10 years old. Now, there's actually no good way to tell when a girl will start her period. Menstruation, or the menstrual cycle, usually starts 2 to 3 years after the breasts start developing. In the United States, that's usually between the ages of 12 and 14. But again, everybody is different, everyone is unique, and some start earlier, some start later. Now, menstruation is your body's monthly way of preparing for a pregnancy. Hormones signal the ovaries to release an egg. That egg gets picked up by the fallopian tubes and travels down the fallopian tube. At the same time, inside the uterus, the tissue that lines the inside of the uterus is growing thicker to prepare to receive that egg. If pregnancy does not occur, that lining breaks down and gets flushed out from the body through the vagina, and this is what's known as your menstrual period. Now, earlier you heard me mention vulva, and you might be thinking to yourself, what exactly is a vulva? I'm so glad you asked. Let's chat about that. Please allow me to introduce you to your lady parts. The vulva is the external genitalia, or your private parts. It includes what's called the mons pubis, which is that rounded area at the lower part of the abdomen in front of the pubic bone that grows hair when we go through puberty. It also includes 2 skin folds, one outer larger fold or larger lip called the labia majora, and an inner fold, a smaller, thinner lip called the labia minora. At the peak of those folds, where the labia come together, is the clitoris, which is a nerve-rich area of tissue that gets stimulated with sexual arousal. Below the clitoris is the urethra, which is the tube that allows urine or pee to exit the body. Below the urethra is the vagina, the opening to the vagina, which is also called the introitus. Below the vagina, and between the vagina and the rectum, is an area of skin called the perineum. And then the rectum is below the perineum, and that's where stool or poop exits the body. Now, the vagina is a muscular tube that connects the external genitalia, or our private parts, to the internal female reproductive system, which includes the cervix, uterus, tubes, ovaries. It allows the menstrual tissue and blood to exit the body during your menstrual cycle. It's where intercourse or sex occurs if you're sexually active. It's also where a tampon is placed if you choose to use a tampon during your menstrual cycle. Now, when your period first starts, it may only last a few days. It could be very light. You could even see reddish-brown spotting. Your period could last anywhere from 2 to 7 days. Anywhere in that time frame is considered normal. If your cycle lasts more than 7 days, you need to speak with your healthcare provider. You should not expect your period to be regular and predictable in the beginning. You could have a period every other month. You may have 2 cycles in a month. It typically takes your body a couple of years to develop that regular, predictable pattern. You do need to keep in mind that if you are sexually active and you miss your period, you may need to consider pregnancy. In order to help you predict your cycle, we recommend that you use a calendar. You want to take a calendar and place an X on the day that you have your first day of bleeding, and then place an X on all subsequent days that you have bleeding. As you continue to do this exercise month to month, you may start to notice a pattern that may then help you predict when to expect your next menstrual period. The best way to help you prepare for your menstrual period is to carry some supplies with you, even if you haven't yet started your cycle. Grab some pads, some tampons, a menstrual cup, and carry them with you. Now, pads stick to the inside of your underwear and they help to absorb the menstrual blood. They come in different sizes, styles, and thickness. Some have wings that wrap around the edges of your underwear to help secure them in place and give you some added protection. Some are smaller and thinner and they're called panty liners. Some girls will wear them at the beginning of their period when they might have light spotting leading up to their period, or at the end of their menstrual cycle when the blood flow, the amount is tapering off. Now, I'd caution you to be careful with the pads that have a lot of fragrance and dye in them, as they can be irritating to your skin. You want to choose your pad based on your body size, your comfort level, and your amount of blood flow. Now, some girls will change their pad every time they go to the restroom. At minimum, you need to change your pad at least every 4 to 8 hours. And then there's tampons. Tampons, like pads, also absorb the blood, but this time from the inside of the vagina, that muscular tube that we talked about before that connects the external genitalia, or our private parts, to the internal female reproductive system. Some of them have applicators that can be plastic or cardboard that are there to help you insert the tampon in the vagina. Others come without applicators, and so you just use your fingers to place the tampon in the vagina. There's a string that hangs down on the end of the tampon. That string hangs outside of the vagina and is there to help you retrieve or to remove the tampon from your vagina. Now, many girls choose tampons because they can be more comfortable to wear than pads. They can also allow you to participate in sports or exercising. You can also swim while using tampons. Tampons should be comfortable to use. Once they're in, you shouldn't feel them. You choose your tampon based on the amount of blood flow that you have. The easiest way to get started with using tampons is to go with the smallest size. You should change your tampon every 4 to 8 hours. Leaving them in any longer might increase your risk for a rare but serious condition called toxic shock syndrome. You definitely need to read the entire instructions on the box before use. And then there's the menstrual cup. Now, this is a cup that gets placed in the vagina, and unlike the tampons and the pads, it actually collects the menstrual blood and tissue rather than absorbing it. Some of these are plastic, some are rubber. Some of these are single use, some can be washed and reused. The menstrual cup should be emptied at least every 8 to 12 hours. Now, unlike the other options, I find that the menstrual cup has a bit of a learning curve and it may take you a few cycles to get used to using it. And then there are period panties, which is a very similar concept to the pad. Instead of a pad sticking to the inside of the underwear, the absorbent layers are made or sewn into the underwear. Some girls use them to replace pads or tampons. Some ladies use them with tampons for an added layer protection. Now, some girls can have cramping, which is pain and tightness in the lower abdomen or the back. Some can also get headaches, nausea, vomiting, diarrhea, or feel dizzy. If your symptoms are severe, if they're persistent and don't go away, you definitely need to talk with your healthcare provider. You should still be able to participate in most of your daily activities. If you need help dealing with your symptoms, you can try ibuprofen or naproxen unless you have allergies or other medical problems. Always follow the use instructions on the label. We've also seen that exercise can help with period cramps, as well as warm compresses or heating pads. Talk to your doctors or a parent if you experience any of the following. If you're 15 years old and haven't had your first period yet. If your periods were regular and all of a sudden they're not. If your periods are more frequent than every 3 weeks or less often than every 2 months. If your periods last more than 7 days. If you are having heavy bleeding where you're soaking, flooding your pad or tampon. So on a menstrual pad, that would be blood front to back, side to side every hour. If you have severe pain or other symptoms that pain medicines or other activities like exercise or warm compresses are not helping and it's preventing you from participating in your daily activities. That's it for today, ladies. I hope this helps someone. As always, I appreciate you. Take good care and stay healthy, friends. If you enjoyed today's video and want to see more like it, be sure and subscribe. I'll see you later.